Most of the discomfort kids experience is often chalked up to a sports injury or growing pains. It's common that after a day or two, any aches are forgotten until the next scraped knee. But when Jakki Maser's back pain started at age 13, it became clear this wasn't caused by the usual wear and tear of athletics.
It flared up really bad to where I could not move, I couldn't laugh, I couldn't talk. I mean, just anything. It was like electric through my body.
After that first experience, Maser's pain would come back every 2 years and completely disrupt the teenager's life.
I knew I was going to have 2 weeks of being in bed and not being able to really do much at all. Get up, couldn't get to the bathroom without help. After that 2 weeks, it was like another 2 weeks of gradually returning back to my normal. So, being able to walk a little bit more and working my way up to, maybe being able to do my sport again.
She ran through every treatment available to manage the pain, but even the steroid injections weren't making a dent. However, when Maser sought professional help, the doctors told her it was probably just a small injury that will resolve itself. As the years went on and Maser's pain never got any better, she cycled through 10 different specialists, 6 physical therapists, a couple of chiropractors and athletic trainers, and even saw an acupuncturist. And even though they stopped dismissing her pain, no one could ever give Maser an answer for why her body was reacting this way. By the time she wanted to start a family of her own, Maser was concerned how pregnancy would affect her back pain.
I had an MRI before and after each pregnancy, and how is this going to affect me? Is this going to make things worse? Can I do this safely? I really wanted to be proactive about that. And I was told, oh yeah, it's fine. You might even feel better. It's no big deal. So I went ahead. I actually, during my first pregnancy and my third pregnancy, I did feel better while I was pregnant.
Maser's second pregnancy caused her to develop pelvic girdle pain. It got so bad that she had to wear a support belt for the duration of her pregnancy.
It was really difficult. I could not hardly get around without that belt on. And then the biggest struggle was right after I delivered. I broke my tailbone delivering my first baby. And then because of that, I developed a cyst the size of a softball and had to have surgery on that within days.
The cyst came back in the 3rd trimester of Maser's second pregnancy, and she had to undergo another surgery to remove it. But everything always seemed to get better. That is until Maser delivered her 3rd kid.
And then I started having flare-ups constantly. And things were just different. I might have a flare-up, and I thought, okay, it's going to be 2 weeks. I know the drill. But it would last a day, and then the next day I was better. Or it would last 12 weeks. It was so unpredictable. I had no idea how long I was out. It was constant, and that's when I really was like, something's got to change.
Once Maser began having sciatica pain that made her numb from the waist down, she sought out 2 neurosurgeons. But instead of trying to find answers, Maser says they were dismissive and said that nothing in her scans would explain her symptoms.
I was so frustrated. After that, I started taking continuing ed classes on how to read my MRIs, my CT scans. I had already taken classes on herniated discs and just all kinds of different lumbar spinal issues, honestly, because I wanted something to stand out that sounded like what I was going through. So I spent time reading my own images. I asked to get a CT scan. We got that. And I saw on there a pseudoarticulation with sclerosis on each side.
Because of Maser's classes, she recognized that those terms referred to a congenital disorder called Bertolotti syndrome. Dr. Colin Haynes says it's an underdiagnosed condition where pain is caused by bone-on-bone rubbing in the spine.
There's this part of the spine called the transverse process, which in our low back kind of points off to the side off our spines. And in people with Bertolotti syndrome, the bottom lumbar vertebrae, called the L5 level, has an enlarged transverse process that rubs against the sacrum and causes sort of bone-on-bone grinding. So essentially, Bertolotti syndrome is when that enlarged bone rubs on another part of bone and causes pain.
Haynes is a spine surgeon and director of research at Virginia Spine Institute. While it's not necessarily hard to diagnose, Haynes says it's so often missed because doctors aren't looking for it.
A lot of doctors, even spinal specialists, know of it in generalities, but They kind of say, hey, I've heard of this diagnosis, but and I haven't been trained on it, or I haven't read up, or not only am I not sure when it may hurt, when it may not, but I also just don't plain know how to work it up. I don't know which test to order.
Which unfortunately is probably why all of Maser's doctors missed it. But even after her self-diagnosis, the physicians in her area weren't returning her calls when she'd explain her thoughts. Some went so far as to state that Bertolotti syndrome wouldn't cause the pain Maser described. Up against a wall, Maser turned to the only place she had ever been able to find a community with answers: Facebook. After noticing that 4 doctors were constantly being recommended, Maser began her deep dive into each one. She got connected with Haynes, and after years of feeling dismissed and talked down to, Maser finally felt like a medical professional was taking her condition seriously.
I told him I'd done all this research and he was excited about that. I told him that I knew what certain medical things were and he was excited about that. And he just believed me, I guess. I asked questions and he would say I don't know, that's a really good question. We could look into it like this, or we could look into it like that. And it was just really refreshing, I guess, to be acknowledged, to be believed, to be just treated like a human being.
Unfortunately, Haynes says that Maser's experience is common, and it oftentimes becomes the patient's burden to dig deeper if they're not getting answers. The good news is that once there's a diagnosis, Haynes says most people are able to get back to normal life without needing surgery.
Some of the initial ones we do, physical therapy, optimizing core strength, really good overall health is good spine health. So the things that we try to do to optimize the spine, whether it's a disc, whether it's a pinched nerve, or whether it's Bertolotti syndrome, can be very effective for getting people feeling really, really good.
However, some people need a more aggressive treatment approach.
So there are the next line of defense. We typically think of injections, whether it's cortisone or emerging area that's pretty exciting called regenerative medicine, like stem cells or PRP or all these other fancy acronyms we hear about. Basically, the premise is using someone's body's healing tissues to actually do the healing.
When that doesn't work, like in Maser's case, the next option is surgery. In general, there are 2 types of procedures that are most often used. The first is a fusion. Since the person's pain is caused by bone-on-bone rubbing, a fusion surgery joins the 2 bones together as one, so that grinding can't happen.
The downside of a fusion is that it's a bigger surgery. Once this level's stuck together, the next level has to work harder, so you can get this domino effect. That's why, in general, I prefer what's called a resection, where it just means creating that gap so that the bone doesn't grind on itself.
They create this gap by removing the enlarged bone causing the friction. While this is the typical patient journey, Maser's experience is a bit different because her condition went undetected for so long. In trying to compensate for her Bertolotti's, other parts of Maser's body had deteriorated.
Bertolotti's in and of itself is not a medical emergency. There's time on your side, there's time on my side to get people treated after adequate diagnosis. However, there's a difference between delaying a procedure for a month or 2 versus a decade or 2. That's not only is that tough on your physical health, but certainly a major toll on your emotional health as well.
For Maser, the chronic pain was so great that even her experience as a mental health therapist wasn't enough to overcome the emotional challenges.
I like to think I have a lot of coping skills and I have a lot of, knowledge and awareness and all those things, but it's so hard when you are day in, day out, having a hard time just participating in life because you're hurting so much. I felt like kind of a failure of a mom. I felt like a failure of a wife. I was not helpful. I wasn't playful. I wasn't all those things that I always thought I would be. And I just couldn't. I just could not be.
Maser used every treatment at her disposal and found immense help in seeing a therapist of her own.
I had a therapist helping me through a lot of this journey and honestly pushing me sometimes to go back to that doctor and tell them what you want and what you need. Be assertive, advocate for yourself. I'm really grateful for her. I think anyone going through chronic pain should have a therapist, have a person to help you through that.
After years of living with Bertolotti's, Maser ended up needing 2 different surgeries, which were spread out over a couple of days last July.
I had a fusion of L5S1, and it was an anterior fusion. And then they did an artificial disc replacement at the level above that, the L4, L5, because that disc was so worn out and thin and torn. So then they went in from the back and they shaved a little bit of the bone off of the facet joints at L5, and my nerves were trapped underneath that, and they were being pinched underneath that.
It's been almost a year since these surgeries, and though the recovery's been hard, Maser says the pain is much less than what she had been living with for more than a decade. Maser started to feel stronger about 4 months after the procedure and noticed a substantial reduction of nerve pain in her legs. Today, she's able to move around her house without any of the narcotic pain medication she'd relied on for years.
I can survive on an ibuprofen, and which is mind-blowing to me that an ibuprofen is enough, So that's been really great. I can play with my kids more. I can do more things with them. I'm not 100%. I'm not going out to run a marathon tomorrow, but I'm working on getting to a point where I can maybe even do more exercise and things like that. But it's a long time to have that kind of instability in your spine. And I think there's probably residual damage and things that I'm hopeful will still improve, but we'll just have to see. But even just where I'm at now is unbelievable.
You can find more information about Jakki Maser, Dr. Colin Haynes, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.